Dr. Jeff McLaughlin is past president of the American Academy for Cerebral Palsy and Developmental Medicine in 1992. In addition to serving multiple years on the board of directors, he also served as membership counselor and on the publications, treatment outcomes, website, and nominations committees. In 2010, Dr. McLaughlin was awarded the Academy's Mentorship Award, and in 2013, the Lifetime Achievement Award. His career at Seattle Children's and the University of Washington afforded him the ability to equally pursue his top priorities and passions: patient care, clinical research, and teaching, with the goals of improving care, services, and research for individuals with disabilities, as well as promoting professional education in the field. While director of the Neurodevelopmental Program at Seattle Children's, Dr. McLaughlin's research program focused on developing better treatments for persons with cerebral palsy and other disabilities. He was an early advocate for establishing the scientific evidence of the long-term effects of selective dorsal rhizotomy, continuous intrathecal baclofen, and botulinum toxin injections. He was also involved in studies looking at the incidence of pain and fatigue in cerebral palsy and in developing outcome measures for quality of life. His commitment to clinical training and professional education best practices have allowed him to mentor and train countless medical professionals to pursue research and clinical practice with rigor, honesty, and humility. Dr. McLaughlin lives in Seattle, where he enjoys the great outdoors and vibrant art, cultural, and sports scenes. Travel is a high priority. He considers himself blessed by his family and friends from around the globe. Welcome, Dr. McLaughlin, to this tribute to past presidents and trailblazers.
Oh, you're welcome. Glad to be here.
Well, thank you so much. And why don't we just jump right in? I'd love to know why you chose to go into developmental pediatrics.
Well, I think it started with, well, in part, I'm the oldest in my family. And my younger siblings some of them were quite a bit younger. So I had a little touch of child development, even growing up. But when I got to the University of Washington for my internship and residency combined at Children's and Seattle Children's Hospital, we happened to have good exposure to the topic in our training, quite unusual actually for the time. And then as I progressed, I also realized that we had some really pioneering people here, the giants on whose shoulders we all stand kind of thing. And so there was a real opportunity in that regard. And then when I got in the Air Force, as we all did back in those days, doing something for 2 years. And I was at Edwards Air Force Base down in Southern California, out in the middle of the desert. And it seemed like every third kid in the door, there was some sort of developmental question. And I could understand that there were questions and I could get good information, but I didn't have a whole lot of background yet in what do you do about it. Right. And so when a fellowship opened up back here in Seattle, and we were already very interested in coming back to Seattle, I just jumped at the opportunity to do that fellowship. And it grew from there.
That's awesome. It's awesome that you've been able to start your career in Seattle and really let it blossom. It bloomed there and finished it out. It's pretty amazing.
Yeah, I'm lucky in that regard. It's a little unusual to be able to hang out in the same place for so long.
And love it like you have.
Yeah. So that's for sure.
So you had many mentors throughout your career and in a variety of capacities. Can you tell me a little bit about them?
I'd be happy to, because they're so important to me.
Yeah.
It started out actually in undergrad with a professor that I worked for, and then subsequently during med school. And they both really instilled in me the notion of passing it forward. So Dr. Waxman at Yale put my name up first on a paper. And I had contributed, but no. And then subsequently, I just got more and more of those kinds of opportunities, which really spurred me on. And here in the Seattle area, I think my primary mentor I need to give credit to is Dave Shurtleff, who ran our spina bifida program and participated in the academy a good bit in regards to those issues. And He was really a leader and a real pioneer. So it was really a nice opportunity to work for him. In addition, Ron Lemire, who was another member of that program, a fellow by the name of Al Rasher, who was very much of a behavioral pediatrician and a very interesting man. And so things have, really gone from there. At the academy level, it was also a bit of good, important mentorship, even just getting involved. Lynn Staley, who was our first fellowship-trained developmental, not developmental, but child orthopedist, was the guy who actually introduced me to the academy and encouraged me to go. And he introduced me around besides. So he introduced me to a lot of the old guard, great guys like Elliot O'Reilly, who was our historian for a long time, Gene Bleck at Stanford. Gene subsequently invited me down to Stanford to see his program, spent a week with him. So there are all kinds of early opportunities like that that were important to me. And so it has just continued along the line. Al Healy, and another former past president, took an interest in my career. And every time we'd get together, he'd occasionally call me up between meetings. He always wanted to know what's going on, always had good advice, and I think was important to me, even though I never worked for him. So that was important. And then another one of the great things about the academy, of course, is the international flavor. And I met and got to know Martin Bax quite well, the past editor of developmental medicine and child neurology. And I learned a lot from him. So those are just some people. I mean, I owe a lot of people in the academy credit, a debt for what I've learned from them.
Well, you ultimately went on to become a great mentor to people. You won that mentorship award and mentored many professionals through their careers. What did your mentors teach you about mentoring that helped you guide others?
Their example, of course, and just that basic issue of encouraging people, giving people an opportunity, both to do well and to fail. You've got to learn, you learn. And but they were there. They were there to ask questions. They were there to be helpful, and they were genuinely interested. So I think that I benefited from that, and it was then rather easy to pass that on, and particularly someone who is eager to learn.
Yes.
You just got to help those people and turn them loose. It's not the same thing as pounding information into somebody who really isn't interested. So that's what I learned.
Yeah, and I was going to ask you about that. What were some of the qualities of those that you mentored that were particularly important, or you felt were important to have?
Yeah, well, there's that sense of eagerness to learn, and that often comes in our field from a strong commitment to looking after people with disabilities that often comes from people's experience other places in life. And so it's really great to run into people that have the same interest and are really, really eager to learn and go after it. And sometimes you have to, kind of open doors for people. They may not even realize what kind of opportunities there are. But once you do that, then people really go, and it's just fun to watch them, encourage them, and sometimes boot them a little bit to keep going. But in general, it's been pretty easy and fun. And Christy Bjornson, perhaps my favorite example of a good mentee. She had just finished her master's in PT when we got together, and she started recording a few things on paper, actually, before we got ourselves set up with our first computer, and things just ran away. So, but there have been lots of others, people who at various stages in their careers and various stages in their interests, it was easy to boost.
Yeah. And I know you boosted her. She's now paying it forward and taking your work and doing great things, ensuring that others are following, and she's following in your footsteps. And
Right.
it's pretty neat to see and to know her. Who were some of your most, or who are some of your most cherished friends and colleagues that have been part of the Academy?
There are so many.
Yeah.
The Academy is a unique place. The people who really thrive on the interdisciplinary interaction, and again, the commitment and interest in what we're doing, show up year after year after year. And many of them, virtually all of them, I count as friends of one sort or another. But there's folks that stick out, like Peter Rosenbaum, Rich Stevenson, and just a host of other people that are just great friends when we get together. So there's just lots and lots of people in the Academy that I really appreciate.
Yeah. Can you tell me a little bit about the Gang of Four?
Oh, the good old Gang of Four. Most people will remember who the Gang of Four were, but that started in my year of presidency with myself, Mike Alexander, Helen Horstman, and Charlene Butler, who followed me in succession. And we happened to be around at a point where there needed to be some big changes. And we just fell together nicely. So we had a developmental pediatrician, a rehab doctor, an orthopod, and a special educator talk about interdisciplinary collaboration. And even though it was around administrative things rather than clinical things, we had a ball. And we dubbed ourselves that, since it was a common term back in those days.
Well, I'm very fortunate to have the opportunity to get to know each of you individually, and this year that each of you is getting highlighted in these interviews. So it'll be fun to hear all of your perspectives coming through each of these consecutive years.
Yes.
So what were some of the highlights from your presidency, 1992? The meeting, I believe, was in San Diego.
Mm-hmm. Yeah. Well, it was great. It was great. San Diego is always a great place for a meeting, of course. And so we could count on the weather and everything. For me, the big thrill was that we actually put on a great meeting. Yeah. In spite of the other issues that had arisen that year. And it was really good. And we were very happy to get the speakers that we wanted, and that things fell into place as well as they did.
Do you recall what the topic was, what the theme was for that year?
No. I'd have to go back and look.
Yeah. Well, we'll find it out for you.
Yeah.
Do you want to share with us a little bit about your most embarrassing moment from that year?
Well, that was easy. It was May or early June. In those days, of course, no internet. So I was getting paper stacks, an inch and a half thick, about once a month from the management office that included everything and that you could possibly imagine that was being discussed. And some months I was just too busy. But that particular month, thank God, I was thumbing through it and looking at things. And about 2/3 of the way down was a little piece of paper telling us that we were not going to have enough money to pay our next installment to developmental medicine and child neurology. So that was both very important, but also very embarrassing for it to have gotten to that point. As I was on the board before I was president, and we all sat around board meetings and this and that, and nobody quite figured out that we were kind of on the edge.
So what did you do to fix it?
Well, we got a hold of management, and they put together a conference call with as many of the board members as we could assemble. Everybody participated, everybody kicked in. There was an immediate, okay, we got to fix this. And without a lot of name calling, just, okay, let's solve this problem. And so we did by asking people to pay their dues early, We asked people to donate if they could. We asked the management, and they quickly volunteered to not collect their fee from us prior to the meeting, because we figured if the meeting worked, we were going to be okay.
Yeah.
And so finally, then we really took a careful look at the meeting and what did we really need and where could we cut costs, and that happened, and we succeeded. And then the Gang of Four had to step in because it was obvious we needed to make a bunch of changes as an organization so that sort of thing just wouldn't happen again. So we wound up with more of a succession. At the time, I was suddenly the first vice president, president-elect, and now, of course, we have a longer chain, right. And we have dealt with the problems. Our successors have done a beautiful job of really solving the financial status of the academy. So it was really our last movement from kind of an amateur back pocket kind of organization to something that really was working. I mean, there were certainly many other efforts along the way up to that, yeah. But that 4 years were really important. And
nobody suffered with a little bit less food at the meeting. It was
probably. Probably, or they got carrot sticks instead of canopies. I mean, but it happened.
Everybody was okay, I'm sure, yeah. And everybody enjoyed San Diego.
Everybody enjoyed San Diego. Everybody enjoyed the meetings. So.
That's great. What about some of the highlights from your career?
The career, I guess top of the list is that in my entire career, which is very unusual in academics, I got to follow kids and their families from when they were born or when they were diagnosed with cerebral palsy or whatever, until they were 21. And that helped staying in one place. But also there are not a lot of situations where you are actually ongoing following those kids. I wasn't their primary care doctor, but they saw us frequently enough that I really got to know people and could see really the courage of kids, where you could get out the abilities that everybody hoped were there, and then to see the power of the families. Yes. It was really quite something, and that was so important to me that when my own wife developed Parkinson's, I drew on that experience of watching other families. And I think a lot of primary care docs that I've spoken to have, about their careers, say something like that, but it's still unusual. So that was one. The research, of course, was another wonderful thing, where I was lucky to be in the right place at the right time and to take advantage of the opportunities that presented themselves. So that we were in an era where the actual techniques for carrying out clinical research to answer yes/no questions was first being developed. And so it was really fortuitous for that to be going along at the same time that I was developing the research interest. So that worked well.
So can you tell me a little bit about the SDR trial?
Sure. The selective dorsal rhizotomy thing came to light a few years before I was president. And when Warwick Peacock moved to the US from South Africa, where he'd been doing, as a neurosurgeon, had been doing some work on that. And he came to a meeting and kind of uninvited, if I remember right, but in a pretty friendly and humble sort of way, and because he was interested in what everybody else was doing. And so he talked about his experience. And the rest of us who had followed kids for cerebral palsy for a long time really perked up our ears to say, oh, okay, we better really sort this out pretty quickly, because we'd all seen any number of trends come and go about this new popular treatment or that new popular treatment that was based on reasonable science, but not really looked at. because the amount of money that's available for research even now for studying things in kids with disabilities is pretty limited. Kids are still a little bit not at the top of the list when it comes to these things. And so that was an opportunity to jump in. And I was fortunate to have our neurosurgeons like John Loescher and Ted Roberts, who were interested in the idea, were academics and interested in some science, and in a setting where it could be done, so that we were able to jump in and get an NIH grant written that allowed us to carry out that research. Yeah. At the same time, of course, the groups in Vancouver, BC, and in Toronto were equally interested, and because we were all from the academy, we really had the same sense of what to do and how to go about things, and collaborated basically, so that the studies all came to a head at about the same time. And none of them would have happened without some outcome measures. So Peter Rosenbaum and his group, with the gross motor function measure presented at the academy, of course, provided us with all of the same measurement tool for outcome. And so we put them together, and great teams of people in all three places pulled it off. So that was really, really pretty neat.
It sounded like it. I was hoping you'd be able to talk about that a little bit, just because it did seem like an amazing collaborative experience.
Yeah. Well, those were the first randomized trials of surgical procedures ever done in kids.
Yeah.
There have been some since, like with the spina bifida study, but that was the first. Yeah. And there weren't even that many studies like that in adults either, because and we had to go to the length of, we couldn't double blind, obviously, but we could try to disguise which group the kids were in, because we had as examiners for the outcome measures, we had experienced physical therapists who at that time were coming back to get their masters. That became important in the PT world at about that time, or a little earlier, so that there was this pipeline of PTs who were very experienced, who didn't live in our area, didn't know our patients, and were delighted to be hired while they were doing graduate work, to go ahead and do the exams. And then we had another person who, before the PT came in the room, disguised whether the kid everybody got a bandage, basically. So it looked like everybody had a bandage on their back. And then that same person would stand there and watch to see if anybody leaked information. And so as close to blind as you could get. But that was great fun. And Christy was huge in that process with her connections into the PT world, because she even talked some PTs she knew into coming to get their masters so they could also do this work.
What an amazing experience, and what an amazing experience for the PTs to be able to participate in that important research at that time.
Yeah.
That's really neat. Can you tell me about the LIND program and working to improve that?
Absolutely. The Leadership Education in Neurodevelopmental Disabilities, funded by the Maternal Child Health Service, our bureau in DC. And they have a long history. They started out funded in the mid to late 60s. Under other names, but we're out of the Kennedy family's interest in supporting research and education regarding disabilities of all sorts. And my fellowship was funded by that same program. And it was unique in really, really putting people in from multiple disciplines. Pediatrics was the only technical doctor one. There were pediatricians, nurses, OTs, PTs, audiologists, speech pathologists, psychologists, audiologists, nutritionists, parents now, something that had been added, and special ed teachers to really first learn to be okay around each other. Because especially back then, the docs were all male, and everybody, most everybody else were female, and the program really has done a lot around the country, expanded from, I think, 8 or 9 programs to begin with, of which ours here was one of the originals. And therefore, we had brick and mortar, where many of the subsequent programs have not. Just been given funding to do things. And it's really had an impact and really changed a lot over the years, too. Either kept up with or even led the times in some places. The only problem with it is funding. The program, when I was director of the program, the dollars we got were just about the same or a little less than when I trained in the program. So there were no more developmental pediatricians having funded fellowships. We were having to find the funding other ways, which fortunately most programs did.
Right. And how did you encourage people to become LIN trainees and LIN mentors and get them involved?
It was pretty easy in the sense that there were always people coming up, like we were talking earlier, people that are interested, people sometimes with some sort of personal commitment. But in any event, we were able to make it lively and interesting so that people would jump in and try it. And then we did things like expand, so bringing back people who had been out in practice a while. Originally, it was pretty much aimed at people coming straight out of their original training. But we added bringing people back who'd been out for a while.
That's a great idea.
Yeah, and then adding parents, and first from kind of an advisory way, and then, okay, that was easy, and what's the next step, and the next step. And as you know, we have parent trainees, and have been doing that now for some time. And I'm glad that our program was early on with thinking that was a good idea.
Yeah. Thanks for elaborating on that. How much do you think the field has changed for better or for worse?
I think it's almost all for the better. Yeah. And it's on account of we've got so much more to do, so much more to offer.
Yeah.
And so much more of a scientific background to work from, tools to help us move forward, the engagement of a lot of other disciplines who we'd love to have represented more heavily in the academy, geneticists, more neurologists, a lot of other people. And but things are just so much better in all those regards. A lot more work is at least teamwork. Maybe not always totally interdisciplinary, but certainly a lot more teams, a lot more recognition of that, a lot more recognition that we're dealing with the whole life of not only the child, but their family, instead of this or that pill or this or that surgical procedure. And so I think we've come a long way. I think we've got a ways to go, but I think we're doing it all. The only thing I regret at all was when it was small enough that you know everybody, and it's easy to share ideas informally and things like that. I mean, that's true of my own medical institution as well as the field. You used to be able to catch everybody at lunch, catch up on what you needed. Now you don't know who the heck everybody is. And in some ways, I'd love to see that in the academy, to see it big enough that you couldn't keep track of everybody, but I can. I'm glad I can.
What are you most proud of with the academy?
The expansion to all sorts of things. I mean, it started out being pretty much an old boys club, and understandably, and we gradually worked our way up, starting way before me, coming along about, let's have people other than board certified specialists be full members, and maybe even some non-doctors like OTs and PTs. who don't have a doctorate. And that took a lot of work. When I was membership counselor, that was a big deal. And finally, came to fruition. I think that was really important and doubly important because that also dealt with having lots more women in the academy and in the field. And subsequently, of course, especially among developmental pediatricians and rehab doctors, we got lots of women, more than 50-50 in pediatrics. And that's all to the good. So that was important. And bigger, more groups of folks. So I think we've done well. And then, of course, we're a lot more stable as an organization. I think we're having a little more clout than we used to outside of the organization, because we're doing a little more advocacy, which is something else that has started and is moving along.
And it's my understanding that you were instrumental in establishing the advocacy committee.
Well, I took a run at it. We had an advocacy committee my year coming in. It limped along, and other people have subsequently done a real spectacular job of moving it up and having it come to the forefront. That's where it belongs.
Yeah.
It was kind of understandable why it hadn't at one point, but it needed to change, and I'm glad it has.
Yeah. What's your vision for the Academy?
Keep on moving. We need to broaden, like I said, broaden some of the science that we ourselves are engaged with. Certainly the worldwide reach that people have been working on now for a long time is really nice. I mean, there are not any other organizations I know of that, at least in the field, that will give us that. There's certainly some others, but that's something we really need to keep working on, because the world's a small place. So we should be able to bring our skills to other places, but also learn from other places.
And do you have advice for current members?
I would love to see current members continue to do the things that have been one of the strengths of the Academy, which is the interdisciplinary part. As I've seen for years and years and years, you go to an Academy meeting and you go to a presentation on one thing, you find everybody there. So the orthopedists go to listen to an epidemiology talk, the pediatricians go and listen to some things on physical therapy, the therapists are interested in surgery, and that's how you cross-pollinate. If you don't just go to your own little show, you don't learn anything new, really. Not anything that you couldn't have learned out of a journal. And sometimes it's just the in-between at the meetings that is some of the best learning of all.
Absolutely.
So people should keep up with that.
I agree. And it's as a parent attending the meetings, it's definitely been really cool to be in those rooms and see all the different disciplines in there, and hearing the different types of questions coming from the different disciplines, and thinking to myself, why is this person asking this type of question versus somebody else asking a different type of question? Right. What's going through their heads? And I'm always, it's really cool to see.
So asking questions, that's the thing people should keep doing.
Yeah, absolutely.
Absolutely. And stuff that I haven't even thought of. I mean, we need to, as I think we're doing year in, year out, is turning people loose and passing the baton, so that the future is going to take care of itself if people stay as interested as they are.
Yeah. You had a really neat story about serendipity that happened as a result of the SDR study. I was hoping that you might tell it, because it involves a little advice for the current members.
This is true. Yeah, it's an important piece, I think. The particular anecdote, then, no data, just anecdote, is that when we were writing the second version of the application for the rhizotomy trial, having been turned down the first time, one of the reviewers suggested that, well, you maybe want to look up this article on basic neurophysiology of spasticity. Gave me the reference. And so I said, okay, I guess I better do that. And it was a really excellent article. It helped me a whole lot in understanding some things that I've been fuzzy about. But the serendipity comes is that I've always had the habit, if I've got a paper journal in my hand, is thumb it. What else is in here? And 5 articles away was an article by our own adult rehabilitation medicine department documenting the reliability and the accuracy and the reproducibility of a way of measuring spasticity in the leg, in the knee, around the knee joint. I said, oh, we need one of those, because we had all been using the Ashworth scale, which we all knew was very subjective and probably not very reliable as the outcome measure for the more, a measurement that's more directly related to the neurophysiology. I mean, the GMFM was a great one for the most important thing, was how the kid could do things. But the science, needed to be there too. So I immediately looked all those folks up and said, hey, wrote them into the grant. And I'm sure that helped us get the grant. So serendipity is really important. You got to be ready for it. You've got to look for it sometimes, but be aware because serendipity will really help.
Pay attention to serendipity.
Yeah.
The other piece of advice that you have mentioned to me, and I think this was a good piece of advice for members, involved orthopods and how they interact. It's one of their gifts to me, the orthopedic surgeons, as a model on how you interact with people in this kind of a scientific setting, which is to say that if you've been to one good session among orthopedic surgeons, they will state their situation, their beliefs clearly. They will provide data nowadays, and they will sometimes then proceed to tear each other apart about, I don't think that's a good idea. What are you doing that for? Yada, 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 seeming to have a little bit of fun in the process. And as a pediatrician, the first time I was exposed to that, I thought, oh my God, they're gonna hurt each other. And because in pediatrics, we don't do that. We're just as polite as all heck. And, but then the observation is, after the meeting, they're all buddies. Go out and have a drink together, hang out, and be nice. And I just really took that to heart, that, yeah, that's the way we ought to be behaving. And particularly in an interdisciplinary setting, which would be hard, but that, interdisciplinary is working if you can see that kind of an interaction where people can go at each other with respect, but go at each other's ideas and then stay buddies. There's other specialties in medicine where they have that same interaction, but then they carry grudges for 15, 20 years. So I really am grateful to my orthopedic buddies, most of who are athletes and played some team sports, I'm sure, who carried that into their interaction in medicine. It's a good one. That's likely a good foundation. It's how to be a team player, and that makes a lot of sense. And certainly great constructive criticism. And I think all those ideas probably lead to even better outcomes and better ideas.
It can, yeah. Yeah, you can be too polite.
Exactly.
Say, oh, that's very nice. When in fact, you're thinking, huh? So, no.
How do you want to be remembered?
I want to be remembered as a hardworking, loyal member of the Academy family. That would just be great. It's been so important, as Al Scherzer has said many times in our meetings. This is my academy, and that's where I'd like to be, just as Al has said it.
I think you're there. And what gives you hope?
The excitement of younger people who are really jumping on it and keeping the ball rolling. The things I've already said about the improvements in the care that's available, some improvements in social attitudes about people with disabilities. It's not perfect, as we know from some things around the Olympics, but it's sure better than, oh, send them away. They look different. So it's coming. And so I have a good deal of hope if we can all survive climate change.
Exactly. Would you like to add anything else?
Only the business that you got to pay attention to serendipity. It's important. And to always look at it as a glass at least half full. That's another thing. It's not if you only look at the things that are wrong, you're not going to have a good time. And that's probably a life issue too, not just our field.
Well, thank you so much for being part of this past presidential tribute. I've loved getting to know you through this, and I've learned so much from you.